watching The Pulse, your weekly guide to global health on Al Jazeera. I'm Shireen El-Feki. Imagine if one of the world's most devastating cancers could be prevented with a simple shot. Well, that's now possible, at least for cervical cancer, a leading killer of women in the developing world. Most cervical cancer is caused by a virus, the human papillomavirus. Now, there are 2 new vaccines to stop this virus in its tracks. But the curse of cervical cancer is far from over. The Pulse traveled to Costa Rica and India to see the latest push against this deadly disease. Javier Quintana isn't a scientist, but he's a key player in the drive to prevent cervical cancer. Every day he sets off into the Costa Rican countryside to recruit women to take part in a trial of one of 2 new vaccines against human papillomavirus, which causes cervical cancer. His first stop today is the home of a 23-year-old mother of 2. Javier tells her about the vaccine trial, and she agrees to take part.
I heard about HPV on television, and I know women who have had cervical cancer. I'm a little nervous because I've always been afraid of injections. And I know this is going to be a little painful, but other than that, I'm happy.
At the clinic, other women are already waiting for their shots. Dr. Rolando Herrero is part of an international group studying the vaccine in Costa Rica.
They come to a first visit to get their first vaccine. They come a month later and 6 months later for a booster vaccination. We're vaccinating women 18 to 25 only because that's the group where we are more likely to find women who have not been previously exposed to the virus. Ideally, this vaccine would be given to women who are younger, but we are not able to do it in younger women because of consent issues.
The vaccine trial is being observed by Dr. Jacqueline Sheris, a reproductive health expert from PATH, a not-for-profit group working in global health.
The HPV vaccine is a major development in women's health. The vaccine offers the long-term potential, with good screening and treatment, to bring cervical cancer rates down worldwide to levels that we experience in the developed world.
If we put this vaccine in the population, at least we should be able to prevent around 70% of all cervical cancers.
Well, this vaccine is against a sexually transmitted infection, and it's going to be provided to young girls who are 10 to 14 years of age, potentially. And this is an issue that's problematic in many countries.
Dr. Rangaswamy Shankaranarayanan wants to change that.
Cervical cancer is an important cancer among women in India. It's the #1 cancer. And in fact, in the world, every year, about 493,000 women develop cervical cancer. And India contributes 25% of this.
Dr. Shankaranarayanan is the driving force behind a radical new approach to screening, which is low-tech but highly effective. He's on his way to a remote part of Tamil Nadu in southern India to see how local women are responding to the new test.
These women have never been screened. There is no possibility for these women to go to the town or to another hospital in the largest town nearby to get screened.
Mrs. Pushparani is the first person to undergo the procedure. It's simple, affordable, and takes only a few minutes. It's called visual inspection with acetic acid, or VIA, and all it requires is iodine or vinegar.
What one does is you apply acetic acid using a cotton swab on the cervix, and you wait for 1 minute, and over 1 minute you look at the cervix, and if you see a white area on the cervix, that signifies an area which can have a very early cancerous change or a pre-cancer. And if the woman is positive for VIA, then the same setting, the result is immediate. You get the results in the same session. So you don't require a laboratory infrastructure large number of people can be trained rapidly, and this test can be carried out anywhere.
It was painless. I'm very happy that the test is negative. I have been told I have no disease at the moment.
In rich countries, routine pap smears have dramatically reduced deaths from cervical cancer. Now millions of women in the developing world have a chance at early detection too, thanks to this and other easy-to-use tests in the works.
There are interesting possibilities now. Countries can think of implementing screening programs with tests like VA and Willy. And of course, vaccination is emerging, another interesting possibility. So with all this, there's a good possibility that one may prevent hundreds of thousands of deaths from cervical cancer.
Joining me to discuss the promise, but also the problems of the new cervical cancer vaccines is Loretta Braben. He's a specialist in women's health at the University of Manchester. Loretta, we have these vaccines. So is that it? Problem of cervical cancer solved?
I wish we could say it was, but unfortunately, life is just never as simple as that. The vaccine gives us a wonderful opportunity to move towards eliminating cervical cancer in the long term. But in the short term, there will still be a need for women to continue with cervical screening or to find other ways of preventing cervical cancer. The good thing about the vaccine is that it's highly effective against the types of HPV, human papillomavirus, that it's meant to protect against.
But it's not active against all forms of HPV.
There are perhaps about 17 types that cause cervical cancer, and the two existing vaccines protect against two of them, HPV 16 and HPV 18. Now, by protecting against those two types, we can probably protect against 70, maybe even 80% of all cervical cancers, because there's probably cross-protection with other types that are quite closely related to those.
But again, that's not complete protection.
No.
I gather the other issue is that the vaccines are not effective in those who are already sexually active.
No, and the vaccine trials have been mostly in young women who have not yet become sexually active, who haven't had more than about 6 partners, and who've been quite compliant with all 3 doses of the vaccine. So at a population level, in women who maybe don't get all 3 doses or at the correct times, they may not be quite as effective. We don't really know till the larger trials are done in big populations.
Now, the vaccine is more effective in those who have not made their sexual debut, but again, that raises a whole set of issues. We see in many countries there's debate about making vaccination mandatory. In fact, in America, for example, several states have tried to bring in vaccination for 11 to 12-year-old girls, but there's been lots of pushback, lots of resistance from people who say that, well, maybe it will promote promiscuity. What's your view on this? Do you think that these vaccines should be made compulsory?
Well, one of the reasons you might want to make them compulsory is that it's a way of increasing the coverage, and perhaps particularly for girls who are not well connected to the health services for any other reason.
So you're saying young women who aren't going to the healthcare system will come in. This is a way to actually connect them.
This is a way of actually connecting them. So that is one argument in favour. Against them, parents feel that it's taking away their choice. And they, in our experience of research with women, feel that they want to be in charge of that decision for their child. And of course, most people would agree that it's quite early on in the process to be making them mandatory.
But the central argument that those who resist the vaccines say, well, it's going to encourage my child to become sexually active. Is there any evidence?
No, there's no evidence of that. I mean, there's an idea that if you sort of reduce your risk in one area, that people will sort of overcompensate by taking risks in other areas, like with seatbelts, for example. There's some evidence that people who wear a seatbelt might drive quicker and take more risks. But overall, at a population level, there's less risk and there's less mortality. So people might compensate by taking more risks, but really the type of research hasn't been done to really make that connection firm.
Now, these vaccines are quite expensive. They're more than $300 per course. So if I'm a health minister in a developing country, what am I going to do? I have a limited pot of resources. Am I going to invest in this vaccine, or am I going to try and scale up my screening programs, which is much less expensive? What would you advise?
The thing is that screening programs are never inexpensive, and many developing countries don't have any screening programs at all. In the very poorest countries, I think we will find that there will be global funds available to help, say, African countries to introduce the vaccine, because they just don't have anything there at the moment. I think the problem is going to be more with the middle income countries that do have, say, some form of screening for women at the moment, and they may not get as much financial support, and I think those ministers are going to have more problems in finding the money to do it.
So it's not a question of either or, it's a question of both?
Generally, and in fact there was a study just recently done in Brazil that suggested that if the price of the vaccine could be brought down to $5, it would be very cost effective to have the vaccine. It would cost less than $150 to save one life.
Well, on that hopeful note, thank you very much, Loretta. Join us after the break when we look at the global fight to eliminate one of the world's oldest and most horrifying diseases.